Ladies, is the sexual intimacy in your relationship lacking, but your partner won't talk about it? Have you noticed a change in your partner's performance between the sheets, but he won't get help? Have you heard that erectile dysfunction can be a key indicator of possible heart problems, but wonder if this is really true? The majority of men between 40 and 60 experience ED, and this is a health crisis that women need to know about. My guest today will spell out the ABCs of ED for you so that you know exactly what to do. Orest is a 67-year-old former periodontal regenerative surgeon turned blogger who's passionate about helping older guys create kick-ass lives for themselves and those they love. He focuses on anti-aging technologies, including testosterone replacement therapy and treatments for erectile dysfunction. He's here to help us women know how to address ED with the men we love and why it's important to do so. Welcome, Orest. So, Orest, erectile dysfunction, it's a huge problem, isn't it, for men and women? Wonder if you can tell us a little bit about why this is such an important problem.
Well, Karen, first of all, let me thank you.
Oh.
Thank you. Thank you for having me on your program. I'm excited to be here, and I'm excited to talk about this. As we talked a little bit about before we got on air here, in a lot of these Facebook groups or on other platforms, about 40% of the comments come from women. So just the first thing I want to tell the women listeners on your program is that you are not alone.
Yeah.
You are not alone, and this is a real common problem, and it has to do with the fact that, well, guys don't like to talk about their problems. They don't. They tend to say, "Oh, everything's fine." They tend to brush things under the rug,
Right.
and like, "Oh no, it's fine. It's fine. Oh, okay." And it's a challenge because that's just kind of the male nature of things. We don't ask for directions, and and we generally don't like to talk. One of the most fearful things that a man can hear, actually one of them is "What are you thinking?" And we need to talk. That just sends a man's blood pressure up big time. So you're not alone. And the reality of this is this is such an impactful problem that it not only affects the man, but it affects the other person in the relationship in significant ways. And for the man, it's about their loss of their masculinity, and their self-confidence, which is the worst thing that can happen to a man. They suffer quietly because they're pretending it doesn't happen, and they don't. This is not something that guys sit around and, I'm a big cigar smoker, and so we don't sit around at the cigar bar and talk about this. Actually, I do, but most of the time people don't.
I bet you're popular at the cigar bar.
I have a lot of listeners. People go, "Oh no, not me," and then they're like, "Oh, right." They're listening. They're full throttle. They got that ear turned towards me, and they're listening. And so men tend to suffer about this due to embarrassment, denial, alone, and then it becomes a cascading effect where they start to get more and more withdrawn, more and more depressed. They push away those that they love. They get irritable. They get irritable about things because things are not working. And
right.
The worst thing is that that awkwardness when and the silence. After you're attempting to have sex, and it doesn't work, and there's just kind of like this. Sometimes there's this quietness that is just as I say, the cliche. The silence is deafening.
Right.
And on the woman's side, all sorts of things are going on. First of all, she wants to be a good partner in that relationship. She wants to be supportive both emotionally and physically. And they wonder after a while, does the man in my life, do they still find me attractive? Do they still love me? Have they substituted me with porn?
Right.
Or are they having an affair? And all those things start to create a distance in the relationship that causes a lot of tension. and that really is the big thing, is to get over that tension, is to get over that denial, and that everything's going to work out. Or the other thing is that, well, this is just part of the normal aging process, and you just have to live with it. And the answer to that is no.
No.
No, you don't have to live with it the way it is. Not in 2020 or 2021, whenever you see this program. There are so many options, and a lot of them are really good. Even in the worst case scenarios, where you know, for some men, it's the erectile dysfunction is actually a part of maybe having an injury. Let's say you have an injury during a prostate biopsy or something else going on.
Right.
So there are answers that are out there that are available.
Yeah, so thank you for laying the field out for us. So this is a women's issue. I know some of my listeners are probably wondering, why is she having this guy on talking about ED? Because this is a women's issue. It's a man's issue. It's a woman's issue. It's everybody's issue. And it's really putting a strain on our relationships. And people who listen to me regularly know that I always talk about good relationships, healthy relationships, as being key to having health. So that's why it's such an important topic that we need to address on the podcast. And I'm so glad that you're here. And so let me just back up a second. And why do guys, when you say, we need to talk about something, or what are you thinking? You ask that. Is that something that they get upset about, that they're taught, or is that an innate characteristic?
I think it's a little bit of both. And I think the other thing is that, you know, there is a way to overcome that. And part of it is taking, to a certain extent, baby steps in the process. Mm-hmm. You know, it's just like, you can't like all of a sudden just kind of unload and expect to have a really big conversation, because that you're usually at that point you're in an upset mode. Mm-hmm. And I think that there's some you know, kind of starting to bridge it, first of all, with understanding, and being, say, you know, we can, you know, part of it is saying, you know, we can figure this out. And I know that you don't like to talk about this, and I know that this is painful, but we as a couple can figure this out and figure out what's going to work, so that we have the ability to have emotional and physical intimacy. That's so important in a relationship.
So is that how you would tell a woman to approach it, is say, I want to talk to you about something that we can figure out together? Or how would you tell them to approach this particular topic?
I think it's that kind of a soft approach that works. And, you know, there's going to be, and it's going to take, with some people, that's going to be enough to open the communication. And with other people, it's going to take several times. It's really, you know, we're all very different in that regards. And also it has to do, I think, with in the relationship with me, how well do you communicate about things in your relationship? Do you communicate on a regular basis? If you don't communicate on a regular basis, well, this is going to take several attempts. This is going to take several. If you communicate on a regular basis, well, then you're already got that line of communication, that line of trust already built in between you. But I think it's quite often to start. And I think the first thing that everyone has to realize is that they are not the first people to face this. Okay, this is a incredibly pervasive problem that most people will not talk about. So the statistics are 40% of men in their 40s, 50% of men in their 50s, 60% of men in their 60s suffer some form of erectile dysfunction. Now they kind of break it down in two categories, erectile dysfunction or erectile dissatisfaction. Either way, it affects your ability to perform sexually in the bedroom or wherever you're having sex. Right. and so it is a very pervasive problem. I mean, the statistics are, you know, between 40 and 69, that is about 60 million men in the United States. So if you look at that, if you extrapolate, about 30 million men in the United States suffer with some form of erectile dysfunction or dissatisfaction. So it's very pervasive. And I mean, now, 5 years ago, no one was talking about it. Now every other place there's a clinic to treat your ED. I mean, on radio, internet, TV, there's all sorts of places. And
Right.
So the help is out there. And I think the real challenge for most people is actually finding out what is the best fit for them.
Right. And I love that you gave those statistics. So it's rampant, it's epidemic. And a couple things came to mind. One is I think that we need to take a cue about talking about sexuality from the younger generation. The millennials, they freely talk about sexuality. And I think that we need to jump on that bandwagon. We've adopted technology and smartphones and all kinds of things and using the internet and the YouTube, I call it. My daughter says that means I'm an old person because I say
the YouTube.
So we need to take our cues and know that now in society it is okay, it's socially acceptable to talk about these things.
Sure.
And as you were talking about how to approach a man, my woman's brain was thinking that I would probably discuss with all my girlfriends how to talk about this with my partner. That's what we do, guys, right? Mm-hmm. And I'd be thinking, should I go buy a book to give to him and then he can leave it so he can read it? Should I talk to my girlfriend and then she can talk to her husband who can bring up the subject with him? Or should I just bring it up because I don't want him to be embarrassed? And we'd be thinking of all these crazy ways to go about it. Yeah. Any of those good or no?
Well, I'll tell you what, the talking to your girlfriend to have her partner bring it up ain't going to work. I can't see that scenario working really well. First of all, they probably have a problem too. And secondly, hey, by the way, your wife asked my wife to have you talk to you about your ED. What the hell? No, that one. Okay, I'm gonna tell you. Normally I don't shut down an idea. I'm not going
shut it down.
Shut that down. Shut that down. I'm gonna say this, and one of the things is that in order to overcome some of the barriers to getting this information. Because a lot of times men don't want to go to the office. They don't want to fill out the form. And everybody kind of knows where you're there. Not only that, but also a lot of times these consultations with these doctors, especially the really good ones that know what they're doing, they can run $200 to $300 for a consultation. Mm-hmm. And so one of the things that your listeners may consider is looking at my digital information product, which is called.
Oh yeah, absolutely.
myjunkdoesnotwork.com. Now, obviously, everybody knows what I'm talking about. myjunkdoesnotwork.com. It's not doesn't, it does not. And so what I've done there is I've done interviews with experts in this area on various cutting-edge medical therapies. And I'm talking about medical therapies that all require a physician to treat erectile dysfunction. And there's several of them out there that were not available until recently. And actually, one of them is very, very new, and it's an at-home version of one of the therapies that is available in doctors' offices for $3,000 to $5,000 at a fraction of the cost.
So which one is that you're talking about?
Oh, you have to go to my site to get.
Oh, you got okay. I'm sorry. And we will put the link in the show notes, and so we'll have more information. Sorry. But
it is a at home. It's an at home sonic wave therapy, and so you can. With all the therapies, with the exception of two of them, involve increasing vascular flow. Because the whole major deal about erectile dysfunction, the majority of it is it's a vascular flow problem and also a retention problem in terms of in the venous system. So when I did these interviews, I sat down very much in a format like this, and would spend about 45 minutes, maybe a little bit longer, with the expert in that area, and really have a in-depth conversation about the various modalities. And this is something that you probably, going to a physician's office, you wouldn't be able to sit down for 45 minutes and get that information. And also, it's just really a fraction of the cost. One of the things I got to tell you that's very interesting that's coming on also is that erectile dysfunction, as I talk to my urologist friends, is starting to affect younger and younger men.
Mhm.
And it's actually, they're seeing younger and younger men showing up in their clinics with this problem, and that's kind of a whole different form of erectile dysfunction. It's called PIDE, which is porn-induced erectile dysfunction.
Interesting.
Yeah.
Really?
And
So they're having porn-induced erectile dysfunction. So do they only have a problem with erections when they're with a human or when they're watching porn?
well, they get desensitized to normal sexual content,
Wow.
normal sexual stimuli that you would have in person. Yes. And and
Go
so
ahead.
and so they become in some actual report that actually rewires your brain in terms of how you think about how sex. And so it's because of the prevalence of porn on the internet and access to it by very young men and to probably young women too, it really alters their sensitivity to normal sexual stimuli, but
Interesting.
also their expectation of what sex is. Believe me, it's, we all know sex is not anything like it is in a porn movie.
Right. Well, that is so interesting, and I'm glad you brought that up because sometimes I have had patients whose husbands have been using porn, and then they ask me how to handle that, and I'm not sure necessarily how to tell them to handle it with a man. But if there are women listening who suspect that their husbands are using porn or they know they are, how would you advise a woman to handle that?
I think again a frank conversation that that you want the relationship, not for them to have a relationship with some
Mm-hmm.
virtual porn person that doesn't really exist. And again, it really just starts with communications and having a hard conversation in a non-caustic manner.
Mm-hmm.
Okay, I think you have to be prepared for when you're having these conversations. One, you have to be prepared for denial.
Right.
Oh, it's fine, oh, it's not affecting us, all of those things. But and it's probably going to take more than one conversation. It's going to take a series of
Mm-hmm.
conversations to bridge that gap. It's not something that it's not a one, and I don't see this as a one and done conversation. I see this
Mm-hmm.
as a series of approachable conversations. And there's always, the option of therapy, of couples therapy, which I think can be
Right.
also very beneficial.
Okay, great. And I did want to mention that one of the things that I often tell my female clients whose husbands are having erectile dysfunction to get them to know that there's an urgency to them getting their husbands the help or helping them see that they need to get help is that what's going on below the belt line is often an indicator of what's going on vascularly above the belt line with the heart. And sometimes erectile dysfunction is the first sign that
Right,
vascular disease is occurring in the heart and they could be at risk for a heart attack.
right.
So it's not something to sit on. So just want to get your thoughts on that.
Yeah, actually, the younger you are that you have erectile dysfunction, the more likely it's a cardiac event.
Mm-hmm.
And that it will precede a significant cardiac event, i.e. heart attack or something like that. So that's a huge factor. And because it is for the vast majority of it is a blood flow issue,
Mm-hmm.
usually, there's significant cardiac implications for many men, especially if you're diabetic or
Mm-hmm.
obese or have any other sort of cardiovascular diseases. So it is to a certain area the canary in the coal mine.
It is, definitely. So don't wait on it, ladies. If your partner's having this issue, you really do want to approach the topic. And then I have another set of women who come to me and they say, Dr. Kyrin, you have to help me. My husband went and got ED medication. And before my issue about not having sex wasn't an issue. And now he's on fire and I'm not knowing what to do. So how do you suggest that they handle that? I know I have my 2 cents.
Okay, so be careful what you pray for. And that to a certain extent, that to a certain extent is a very significant thing. I think one is that is to for the woman to take inventory about herself also,
Mhm.
because she's set the man in her life off to get something better, to be improved, and not to say that that person is deficient, but think, is there something that I can do in my life to bring my sexual energy up, to bring my libido up? And we're a lot of times when we're talking about postmenopausal situations, where the answer really may be, or more likely than not is, I'm going to say is, some form of hormone replacement therapy to do that. And it's not. People think that hormone replacement therapy is all about sex, but it's actually about a lot more. It's about osteoporosis. It's about brain function. It's about cardiovascular health. It's about mental acuity, attitude on life, skin tone,
nails, hair.
Yeah, exactly. All of that is affected. And we are being bombarded, our endocrine system is being bombarded by all sorts of toxins that are affecting us in many significant ways that have incredible effects on our whole hormone system. And it's actually some of the stuff that's out there is actually pretty incredible. One of the things that there's two statistics that a lot of people aren't talking about, but are very, very important is going on now. Between 1973 and 2011, there's a study out of the Hebrew University in Israel. Men's sperm counts in the industrialized world are down by 50%. Down by 50%. And that decrease is continuing. The pace of that decrease is continuing. And they have extrapolated that by 2050 or so, most men in the industrialized world will be infertile. Okay. Now, as I've talked to a few gynecologists, what they've noticed in their fertility practices is that the situation where the issue of fertility is with the man is increasing.
Right. Right. We used to say it would be 50% chance that it'd be the man, 50% the female, but that is rapidly increasing.
Yeah. Yeah. So that's the thing. And the other thing is that generational levels of testosterone in men are going down significantly, and they have been for decades. So there's the male normative aging study. It was done in the Northeast, and they looked at that for a period of several decades from 87 to 2005. And generationally, those are things. So those are all things that are happening because of GMOs, radiation, all sorts of fertilizers, all sorts of stuff that are being put into the environment, processed foods, things like that it's really a significant assault on our endocrine system.
Right, all of these endocrine disruptors, and this is why detoxification is so important, and hormone balancing. We talk about for both men and women. So I'm a big proponent of bioidentical hormones.
Sure.
And like you said,
Exactly.
It helps with, you have more of those sex hormone receptors in your brain than you do anywhere else. And that should tell you that it's about brain function, and you have them in your bone and your skin and your hair and your nails. Every cell has receptors for these. So really that premature aging, or what we consider quote unquote normal aging, is oftentimes due to an age-related decline in these hormones in both men and women. Even though men don't go through menopause, they go through manopause.
Yeah. Well, the challenge is, and a lot of erectile dysfunction has to do with testosterone levels going down in men. And it starts rather precipitously for a lot of men at age 40. And the thing is, what's the experiment about is it the frog in the boiling water?
Yes, right.
Okay. So if you throw a frog into boiling water, it'll jump out. But
Right.
you can put it in warm water and slowly turn it up, and it won't jump out because it accommodates. Well, men, menopause kind of happens relatively quickly in women. It's over a few years period of time to a certain
Well,
extent.
it can be
Yeah,
5 to 10, sometimes 15 years, but yeah.
yeah, but
So it's that
yeah,
decline.
for men, it's just a very slow,
Mm-hmm.
very slow decline, and so men accommodate to that low testosterone level.
Mm-hmm.
And they just kind of assume that's the way it is, and they look around and say, okay, well, everybody looks like that. Yeah, everybody feels like that. And they go like, oh, okay, well, that's normal. I'll just keep on going along. I mean, I don't have any problem sharing because I do this with a lot of people. I've been on testosterone replacement therapy for over 25 years.
Mm-hmm.
And I know, I can tell what happens when I go off it. And it's not it's not a good thing, and it's not about sex. It's as much about your mental attitude. And it's just kind of as a personal example, a little bit over a year ago, I was with my youngest daughter, and we went to New Zealand for a trip. Actually, it was a delayed high school graduation trip, and we spent 3 weeks in New Zealand. And because I did not want to deal, one bad day with a border agent with your prescription drugs, even though they may or may not be legal in that country, could ruin your vacation. It could be a bad start to your day. And so I left all my medications there. And about day 7, my wife is going like, "You're really negative. What's wrong with you?" And then day 10, I'm on the phone with her, like, "Did you take your testosterone?" I go, "No." She goes, "Wow." And the half-life of testosterone, cypionate, is basically 7 to 10 days. So it just showed up right away in my attitude.
Yeah. And so what are some of the things that people listening might look for in their partners to notice that maybe their testosterone is low? What are some of the symptoms they might exhibit?
Crankiness. I remember that. I don't know if there's that movie, Grumpy Old Men, with Walter Matthau and Jack Lemmon. Those are two very examples.
Okay.
Grumpiness, a sudden gain of weight around the midsection.
Mm-hmm.
I have a very interesting relationship with my physicians, because one of them, I came in and I hadn't seen him for about a year and a half. He was actually he's my a doctor, and I looked at him. I came in and I looked at him and I go, "Greg, you're getting fat." He goes, "I know." He goes, "Yeah, I have no energy and everything." He was like about 43, 44. And I said, dude, you need, you're suffering from low testosterone. He goes like, "Oh," I said, yeah. He knew that I'd been on testosterone for many years. Right. And he got on it, and about 6 months later, he sent me a email. He said, "Oh my gosh, I can't believe it." He said, I've lost 2 inches of my belt. I'm putting muscle back on, and I feel great. I have full of energy." So I think one is grumpiness, low energy, putting on of visceral fat, loss of lean muscle mass, and just kind of a lack of energy and purpose.
Vitality, drive.
Well, yeah, those kind of things. So I think those are probably the biggest things. So and then you become kind of distant, you kind of become morose, and then you start saying things like, "Oh, well, that won't work." Everything doesn't work. Now, it'd be just kind of a negative attitude, because I think it's just. I mean, from my perspective, I think testosterone is the most powerful antidepressant in the world for men.
And depression, anxiety, they might notice. And, it's funny because it's similar to the perimenopausal symptoms that women will experience. And usually the hormonal decline starts around the age of 40. So between 40 and 50, we're slowing down. And then there is that kind of final, and it's done. But a lot of the same symptoms, the fatigue, the weight gain, the grumpiness, the lack of mental clarity, memory problems, skin, hair, nail problems, all of that. So ladies, if you're listening, same symptoms you might be experiencing, you might notice in your man, but now you might think, oh, you might have a testosterone deficiency.
Yeah, it's kind of interesting. We just recently moved to Las Vegas, but I've lived in Phoenix, Scottsdale area since 1960. I actually grew up in that area, and
Mhm.
I went to the same gym for over 30 years, and it's interesting to see how people age, and I can tell you exactly who is on testosterone therapy and who's not, and the some of the people, one particular guy. I mean, he is. And I tease him a lot. I mean, he's starting to get he's got the build of a beach ball now. And this guy used to be a college football athlete.
Wow.
Yeah, but I mean, he's got the build of a beach ball. And then so if you're a endomorph, you're gonna get, without testosterone, as your testosterone goes, you're gonna get fat. The flip side is if you're an ectomorph, you're gonna shrivel up. You're going to
Right.
start getting all that hunched over look, and the next thing you know, your shoulders are meeting in front of your chin, and so
Not a good look.
not it's definitely, that's not, if guys, that's not going to bring the girls to your corner. If you're saying, yeah, it's not a particularly attractive look, and so it is just is such an important thing for people in their lives to basically have their hormones optimized, both men and women.
It is, and I hope that we're coming into an era. I think we men are ahead of women on that curve, and mainstream medicine has really embraced testosterone replacement. So a lot of regular, quote unquote, I call them regular doctors, are hormone literate who treat men, and they will actually check levels and they will do replacement. With women, not as much, still giving some of those synthetic hormones that have dangerous side effects, not necessarily using the bioidenticals. But I'm hoping that we're really moving into a time when hormone replacement, biologically identical hormone replacement, is the standard of care to prevent aging. And we no longer accept the lie that we're going to get old and decrepit, tired,
Right.
overweight, and be a beach ball as we age, because we really shouldn't.
Yeah.
Yeah.
Yeah. I just want to comment a little bit about levels and
Sure.
what the numbers mean, because I actually interviewed a guy who's incredibly smart. I couldn't believe when he told me he likes to read. He reads about 11 research papers a day.
Wow.
I was like, oh my gosh, just shoot me now. One a day, we can just shoot me now too. But I interviewed at great length about the lab levels, and what's happened is that because of the decline in men's testosterone levels generationally, actually the ranges are going down.
Mm-hmm.
And the ranges are built not of optimized or healthy people. They're actually intermixed between unhealthy and healthy. And so you will find a fair number of doctors will tell you, oh, you're normal. And then like, because I talk to men about this quite often. I say, they're normal. And I go like, well, what's your number? And I'm going like, gee, do you know that number up until about 2 years ago was actually below normal? But now because of the ranges have shifted. Mm-hmm. So I think that there's a whole deal out there. I have a friend of mine, and if it's okay, I'll give a plug for his book. It's called the Testosterone Optimization Therapy Bible. His name is Jay Campbell, and if you want a book, actually I've interviewed him on some. Actually, he's part of the series at myjunkdoesnotwork.com. Uh-huh. But he has probably one of the most detailed books on testosterone optimization therapy that's out there, and it's about 400 pages with about 500 references. So it's not it's a highly researched and highly when he says stuff that he's got basically scientific research to support the claims that he's talking about.
Go ahead. I love that you mentioned that. And really, this is something I talk about with women too. The quote unquote normal ranges for thyroid, for sex hormones are normal based on an abnormal, unhealthy population.
Exactly.
We want optimal function. So.
Yeah, you wouldn't want to fall into the normal for body mass index.
No, you wouldn't.
Yeah, you're absolutely correct. Yeah, because I mean, a lot of time there was a time where actually physicians used to treat to symptoms and not to laboratory values. And so now the whole thing is and part of it is the, there's lots of pressures both from the medical, legal, all sorts of things that are actually kind of forcing us into this false what I want to call safe place. It's actually not safe of the normal values. I think thyroid is absolutely one of those.
Right. Exactly.
Where I've spoken to a number of friends, physicians, that they say that actually the effective dose is just a little bit above where actually those values are.
Yeah, they use the normal, but it includes abnormal people. So it's interesting. So Orest, I do want to ask you about another group of patients I deal with. I have one patient who comes to mind, and her husband's having erectile dysfunction. So intimacy has fallen off. He doesn't want to really talk about it. I've been working with her on her hormones and her sex drive, which had gone away too, because she really was missing the intimacy, because physical and sexual intimacy are part of a healthy, intimate relationship, usually. And she almost said to me, she has said to me at one point, it doesn't really matter. He doesn't have a sex drive and he's not going to really do anything about it. So it doesn't matter. What would you say to that?
Well, that sounds like resignation to me.
Mm-hmm.
And the question is, what do you want for your life?
Mm-hmm.
I've never been one to accept things as they are. I believe in altering my environment, things like that. And I can see where after years you just get tired and frustrated. I totally get it. I mean, especially if you're the only person that is interested in this and the other person is not. I think that's a couple that requires some sort of counseling. To be real honest, it's not. I don't think that for many people, especially in that kind of situation where they're resigned, that they have the ability to resolve that on their own. And I think the challenge, though, also, and admittedly so, is getting both of them to a therapist. And that's going to be an uphill struggle. And I totally feel for that person, because one is, in order to solve something, you really have to have both people involved and be interested. And part of it has to do, again, with having a frank discussion, saying, I miss this part of our relationship, and I want it back. I want it back with you.
Right.
And I want it, and I can't do this alone. I need you to be part of this journey with me, and we can actually have a vibrant life again, like we used to.
Right. And I love that what you said about that. I do think it requires outside help, and knowing that it's about so much more than just sex. It's about physical health. And so if you go silently into the night, letting your sex drive go, you're also going silently into the night to dementia, hair loss, bone loss, cardiovascular disease, all the other things that these sex hormones help with. And so, one of the things, I don't know with you, it's just really getting people to understand. If you have a hard time getting guys to understand, and hopefully in your My Junk Does Not Work program, you address this, that it's about so much more than sex.
Right. Oh yeah, it is. It is. And like for me, as I mentioned earlier, the whole thing of when I was traveling with my daughter, and even now, it is, to me, it is a big source of energy and enthusiasm for life. And my wife, it's pretty funny, because I know we went to a high school reunion a few years ago, and she goes, "Oh my God, I didn't realize how young you are compared to your old classmates." and it's like I'm 67. And I don't feel like I'm 67. And I look at people that are 60 and 50, and there's some people that feel older than I am. And it's a lot of that has to do with is attitudinal. I mean, I've got a lot of stuff I still want to accomplish in my life, a lot of stuff I want to do. And so there's the idea of me chasing a little round ball over the grass every day of the week is not appealing, and so it's really about it's about the whole attitude thing. And as I tell men, I tell friends, and sometimes it really perplexes me about why you don't at least try it.
Mm-hmm.
Try testosterone for 3 months. If you don't like it, it's out of your system in 2 weeks.
Mm-hmm.
You're done. But you may, once you get on it, you're gonna like not really want to. And there was a lot of, and part of it also is that there used to be a lot of false myths about it. It's going to give you heart disease. It's going to make you infertile. It's going to cause prostate cancer. It's going to affect this and that. I mean, I've been through it all with my PCPs and all that stuff. And as I said, I tease him. Actually, my PCP is actually an ectomorph, and I was giving him a heart. The other one was getting overweight. This one I'm talking about, you're shriveling up, dude. And so it's so much about lifestyle. It's so much about the quality of your life, and try it. It's actually relatively inexpensive. I mean,
and a good question though I just want to talk about is who's not a candidate for testosterone therapy, and any precautions when you do use it.
I'm gonna refer that to. I'm not a physician, so I can't think of a situation where somebody really is not a candidate. I think that I'm sure there may be, and I think that for the vast majority of people, that's good. I think we're talking about unicorns there. For people that would not be. I think that the challenge now is that everyone's got a testosterone clinic on TV. Right. And there's a couple of things, and again, I'm going to say this, I'm not a physician and I don't prescribe testosterone, but there's a couple of things that are out there. One is that a lot of these clinics will put you on kind of a three medications all at once, including testosterone. And I think that for the vast majority of people, the other two are not necessary. And testosterone therapy just by itself is plenty. There might be some supplements and things like that, but they don't do that. The whole thing is that there's a lot of research coming out about the negative effects of estrogen inhibitors, aromatase inhibitors. Mm-hmm. Yeah. So there's a lot of stuff that's coming out that it actually is interfering with some of the benefits in men of having estrogen. And this is the 11 study per day guy that I interviewed. We talked a great deal about that. He said that for men, and it's a very individual thing, we all have a balance of testosterone to estrogen that's genetically defined. Mm-hmm. And you start altering that, then you start having all sorts of problems. Now, the aromatase inhibitors came out of the bodybuilding world where they just wanted to, those people do all sorts of crazy stuff to their body, and because they want to lean out for a show. They do aromatase inhibitors, they do Lasix, they do all that stuff to basically lean themselves out, get a more ripped look, but on a long-term basis, none of that stuff is really sustainable. And so I think that's probably the biggest thing is I would caution. That's my advice, again, not from a physician standpoint, is just somebody that goes just straightforward fashion, listen to them. And then again, I'm going to go back to Jay's book, Testosterone Optimization Therapy Bible. I would get that and read that from cover to cover, because in that book, Jay outlines it very well. And I've interviewed Jay multiple times, and he's been on my site at oldguytalks.com. And he's, again, under the Sex, Drugs, Mind, Body tab. I've interviewed him, and I've also interviewed a doctor by the name of Keith Nichols, probably one of the most knowledgeable physicians about testosterone optimization therapy at great length, and where we go, again, 45 minutes, an hour, where we
Right.
sit down and talk at great length about therapy, about the myths, about the pluses and minuses of various things.
Fabulous. So you have lots of resources on your website. You've got the myjunkdoesnotwork.com and the oldguytalks.com.
Right.
We'll have those in the show notes. So lots of information. So if you're listening and maybe your partner is struggling with this and you want more information on it, definitely go to Orest's site and check out the information that he has, the program that he has, the information that he has, and educate yourself, because really part of having her brilliant health, if you have a male partner, is having his brilliant health, and so that the two of you can support each other. And sexual intimacy and intimacy in general, emotional intimacy, is very important for a vital, alive relationship. As you age, you don't want to become separate and distant. You want to become closer and nurture that relationship, because it nurtures your physical health. Studies show that if you have better relationships, you have better physical health. So thank you, Orest, for coming and sharing with us this wonderful information. Do you have any last words you'd like to share, or more about any of the tools that you've offered for people?
Yeah.
Yeah.
I think that most people, a lot of people, just take in information and don't do anything. Don't be that person, okay? Sitting here and listening to this podcast and then at the end not doing anything is, you've just wasted 45 minutes or whatever of your time that you'll never get back.
Right.
Do not just be a consumer of information. The power for you, for everyone listening, both men and women, is in taking action and not just being passive about it and not saying, oh, that sounds interesting. Take action. Whatever it is, take action.
So what would be your top 3 take action steps if a woman's listening and her partner is struggling with this? Top 3 steps.
Okay. First of all, for erectile dysfunction, I would suggest going to myjunkdoesnotwork.com.
Okay.
And when you get the digital information product, it's easy to sit down and listen to the various interviews to find out what your options are. Where we go into great detail. Now, some of these things, and I'm going to be very frank about this, some things work better for others than do. Now, not everyone has the same response to the various modalities, right, therapies, and each of them has their pluses and minuses. And we go into that length. 2 is to share that, especially if your partner is reticent, is in denial, to have a conversation and say, okay, this is what I found out, and there are answers to help us solve this. And 2, to understand that this is going to take more than once, more likely than once. And then lastly, I'm going to say, have both your man's and your hormones therapy tested, because it's not just getting one person optimized and the other person's not optimized, doesn't really work out so well. Right. And so having both people optimized is really critical. So don't just look at it as being just them. It's actually probably a little bit of both of you, and maybe do something that's going to surprise the hell out of your partner.
So I love it. If you're listening, number 1, check out myjunkdoesnotwork.com. Number 2, share it. Number 3, get your hormones checked and get your partner's hormones checked. And thank you, Orest. I have one last question for you that I ask everybody. The name of the podcast is Her Brilliant Health. And what does that mean to you?
Her Brilliant Health actually means that it's about women taking advantage of the opportunities that are out there in this time to improve the quality of health and improve the quality of their life. And it is really about the quality of your life. There are so many things available out there. There's so many options of things to do that you can improve your life and feel better about yourself and the world around you. So when your health is good, guess what? Everything else seems to fall in line too.
Yes, I love it. It's so true. When your health is good, everything else seems to fall in line too. Thank you so much for joining me today. You've offered some wonderful information. I know there are going to be some very serious conversations happening from women and talking to their partners about this. And there'll probably be some women who actually will get their guys to go to the doctor and save them from having a heart attack. That's the biggest issue.
Sure. Oh, yeah.
Because they've gotten the attention, but also they will be having good sex and healthy intimacy. And thank you for sharing the information.
My pleasure. Thank you for having me on.